Hi, I'm Dr. Brian Humphreys. I'm a board-certified otolaryngologist, head and neck surgeon. I'd like to talk to you today a little bit about sinuses, sinus disease, and endoscopic sinus surgery. Sinus disease is considerable. In this area of East Texas, allergies and our environment are very strong components of our sinus disease. Things we breathe are just not healthy anymore. Allergies are a considerable component. Fortunately, we have a sinus wash that we recommend. If you have not received a copy of my sinus wash, please ask for one. I'd like to show you a picture of the sinuses and various stages of illness. Actually, this first stage is normal. In the normal stage, there are small cilia, which are finger-like living shag rugs that sweep secretions and mucus toward the sinus pore. The pore is actually located towards the top. A little bit of inflammation, such as a cold or allergy, will produce clear drainage and swelling of the lining that immediately begins to block the pore. Normally, the pore is the size of that hole at the end of my pen. It's not very large, and it will block very quickly. That swiftly leads to an acute sinus infection. Acute infection means one that has been present for a short period of time. When it's present longer than 12 weeks, we call it a chronic infection. The inflammation is greater, the obstruction and blockage is more, and the amount of secretions that are retained within the sinus are considerable. The object is to get the sinuses back to normal as quickly as possible. If there have been problems with allergy, we also need to treat the allergy to get beyond this stage. If surgery is recommended, you may hear the term windows. Evacuation of all the secretions is important, and a pore may need to be enlarged. We call that a window. This is a window. Most windows, however, are round and not actually square as you'd find in your home. The indications for sinus surgery are whenever medical therapy has failed. Many people come with complaints of pain, obstruction, drainage, soreness, pressure, and headache. Most of the pain and headache is located in the perimeter of the sinuses, which are located around the eyes. In this view, the sinuses of the forehead and the sinuses of the cheeks can easily be seen. The sinuses, called paranasal sinuses, are located in the forehead, in the cheeks, and all the way back to the base of skull area. Sinuses between the eyes are honeycombs called ethmoid sinuses. All of these can become inflamed and infected, fail to cure, and require intervention. Alternatives to sinus surgery include medical treatment, allergy treatment, avoidance of allergens, daily saline rinses, and other treatments which I or your personal physician may recommend. If you have more interest in these, please ask me. The benefits of sinus surgery are considerable. If you are suffering from pain, congestion, and inflammation, Dale Rice at the University of Southern California has studied this surgery, and his results are that the surgery is 93% effective. The University of West Virginia has also studied the sinus results and found them to be 91% effective. Very similar. The results are in the 90s. The risks of sinus surgery are well known. Probably the greatest risk is failure to cure. Nonetheless, with cure rates in the 90%, that risk is low. bleeding, persistent infection, scarring within the nose, injury to important structures such as adjacent eye nerves and even the brain have been reported. Fortunately, these complications and risks are very rare and uncommon. Other risks and complications include nasal dryness and the sensation of nasal obstruction. Postnasal drainage may also still be present. Surgery does not cure allergies, and if you suffer from allergies, the surgery alone will not be sufficient to control your allergic symptoms. Additional treatments for the allergic condition will be necessary.